Want to turn to a family's quest for answers. They brought their mother to a Toronto hospital for blood tests, and she ended up injured during a confrontation with security.
And we want to warn you, the images in this story are graphic. The elderly woman lives with dementia. Her story raising questions about the treatment of patients and ER staffing. CTV's John Woodward joins us live from Michael Garron Hospital tonight with the story. John.
Michelle, the 84-year-old woman's adult children say they can't believe they took June Turcotte to Michael Garron Hospital's emergency room to get better. She ended up much worse in a story they say is a sign that they were personally affected by many systemic issues in our healthcare system.
I was absolutely horrified.
Horrified to see the face and arms of her 84-year-old mother, June Turcotte, covered in bruises after what was supposed to be a visit to investigate low blood sugar.
And I went to my car and just cried. I was sobbing. I just couldn't believe that anyone would do that to a little old lady.
Turcotte is deaf and has dementia. She arrived at Michael Garron Hospital ER around noon on September 19th and was still there by nightfall. Her daughter, Shelley Pett, told staff to call her for any reason when she went home. And she says when she returned the next morning, a nurse told her her mom was agitated and a security guard put her in a headlock.
She was no threat to anybody.
Turcotte's family says despite months of effort, they're no closer to figuring out what happened. They haven't been shown a video of the incident and want to know why her medical records say confusion and pain as reasons for x-rays rather than referencing the injuries she got in the ER.
It feels like they're trying to sweep this under the carpet and they're trying to cover it up.
The hospital told CTV News it's not able to comment on any particular patient due to privacy. It says it does train its staff in de-escalation techniques and says it's not uncommon for hospitals to work with law enforcement alongside patients, families, and their care team as a supplementary measure. Dementia can be a complicated disease to handle and needs compassion, something that's not always available in a busy ER, says the Alzheimer's Society.
Hospitals, they're often not dementia-friendly places.
And in Ontario, they're busier than they have ever been. New figures released show 1 in every 10 patients admitted to a hospital through an ER waits at least 2 days before they get admitted with a bed.
The patient has nowhere to go.
Emergency Dr. Raghu Vengopal says the longer people wait in the ER, the more they can have unpredictable outcomes.
It's really tragic, John. Her experience is all too common.
At a news conference, Health Minister Sylvia Jones defended the system.
We have made a number of investments with our hospital partners to make sure that they have the resources that they need.
Ask if we really are at the situation now where the ERs are so busy, they're calling security guards to respond to patients instead of nurses and doctors.
Listen, we have emergency departments and clinicians working in emergency departments under very challenging circumstances.
You know, you can feel that tension in the air. Everyone has been overworked and
Something needs to change because it's not working.
Turcotte's family says they want systemic change so no one goes into hospital and ends up like this. The family tells us they have taken another step, which is filing a police report. When we asked the Toronto Police Service how that investigation is going, they told us it is very active. Reporting live from Michael Garron Hospital, I'm John Woodward. Michelle, back to you.